Welcome to Part 2 in the Sportswear Online implementation training for outreach programs. Once you have created groups, added users, and assigned their administrative and program rights as shown in Part 1, you may follow this video to assign their database access. This video will show not only how to grant users the database access, but also give an oversight of the different types of information each database houses, and the benefits of tracking this information in Sportswear Online. To update a user's database access, go to Admin, then Users, select the user, and click the Edit button. Then click the Database Access tab to grant or deny this user access to the various databases in Sportswear. Sportswear allows you to track a wide range of information related to your athletes, including but not limited to their demographics, injuries, in-house or referred treatments, and mental health or coronavirus symptoms. You can also track signed out equipment or athletic training room inventory. From the Database Access tab, select which databases this user will be able to view, edit, add, delete, or print content from. This selection can be applied to all databases by clicking the checkbox at the top of the list, or an individual database by clicking the Yes/No toggle buttons. If a user is granted any type of rights in a database, they must always be granted view rights so they can access that database. Without view rights, the database will not appear in the database button bar. As stated before, information in Sportswear is organized into databases. Athlete. The athlete database is where athlete demographics and other information is housed. Athlete demographics consist of the athlete's name, birth date, grad class, and social security number if required. If your school chooses to allow athletes or their parents to enter their own information through the athlete portal, their login information is managed here. Play status, sport, group, address, emergency contact, insurance information, medications, medical alerts, and any paperwork or attachments like physicals or other forms are also housed in the athlete database. As mentioned earlier, athletes or parents may enter an athlete's demographic, medical, or other personal information and answer COVID-19 symptom or PHQ-9 mental health questionnaires directly into Sportswear Online through the athlete portal. Injury. The injury database is where injuries are tracked. Information collected in this database includes when the injury occurred, the body area affected, return to play date, actions taken in response to the injury, what type, if any, referrals were required, injury type, site, and severity. Background information like mechanism of injury, position played and protection worn when injured, environmental factors, ground surface, pain rating, and any uploaded attachments or notes related to the injury. Treatment. The treatment database is where treatments are recorded. Treatments can be applied to specific injuries or non-injured body areas. Here, the specifics of when, by who, and where treatment is provided, treatment modalities, and changes in pain rating are collected, along with any attachments or notes related to this treatment. Medication. The medication database tracks medication administered to the athletes by the school. Insurance. The insurance database houses insurance claims, invoices, or outstanding bills. Referral. The referral database tracks the doctors, specialists, clinics, and services athletes are typically referred out to. These doctors or providers may be input from the phone database by clicking the binoculars icon. The appointment date, provider, service, and specific injury, if relevant, may all be managed in the referral database. Doctor's orders. The Doctor's Orders database allows users to manage doctor's notes and attachments. Many users will attach this information to a specific injury record instead, however, that information may also be tracked here. Surgery. The surgery database tracks any surgical procedures athletes have received. Sign out. The sign out database tracks any equipment signed out to athletes that you may want back, for example, crutches or braces. We recommend including a cost for these items to incentivize your athletes to return them. Weight. The weight database is for athletic trainers to track the athlete weigh-ins or weigh-outs if they manage that information for your school. Physical. The physical database is intended for schools who do their own in-house physicals or any schools that wish to store athlete physical information in a format that is mineable. The list of items of interest in this database can be customized to match your school's physical examination forms. History. The history database houses athletes' medical history. As with the physical database, what information the history database collects can be customized to fit your school's needs. The information may be input into this database by a user or by the athlete themselves through the athlete portal. Inventory. The inventory database tracks price, quantity, vendors, and usage of consumables in the athletic training room like tape or TheraBands. Equipment. The equipment database tracks information on athletic training room equipment like ultrasound, ice machines, and whirlpools. Here, the item's make, model, cost, and service or inspection dates can be tracked. Phone. The phone database is an online phone book or Rolodex. Information on doctors, clinics, vendors, and insurance companies can be housed here for easy lookup. Users. The user database is where access to data in sportswear is defined. This includes the rights of the coaches, physicians, athletic trainers, and athletic directors in the system. Concussion. The concussion database consists of VOMS, SCAT, SAC, or SCAT-5. This database includes not only instructions on test administration, but also test results. If your school is interested in more extensive cognitive or concussion monitoring, contact us about our Concussion Toolbox add-ons or partnership with BrainCheck's digital cognitive health platform. Exercise. The exercise database is where exercises for rehabilitation or strengthening can be prescribed remotely to athletes. The exercise database is an add-on and not included as part of a sportswear license. COVID. The COVID database contains a daily screening questionnaire for athletes that can also be used for school staff and general school population. The questionnaire is based on current CDC recommendations. Information may be entered by a user or by the athletes themselves through the athlete portal. Reports may be generated from this database, as with all databases, to communicate coronavirus risks or exposure with others in the athletic department or the greater school community. PHQ-9. The PHQ-9 database houses athlete responses to a 9-question patient health questionnaire on their mental health status. This is the mental health screening tool used in sportswear. It allows users to track and generate reports on students' self-reported depression levels. Once you have set your desired database access rights, click the Save button. As stated before, Sportswear does not automatically save changes, so be sure to click the Save button whenever you make updates and not simply close out of the page. As with the administrative changes in Part 1, for these database access changes to take effect, you must log out of Sportswear. Once you log back into Sportswear, you will see the changes you have made to your database access in both the Database button bar and Database drop-down menus take effect. Be sure to update the database access rights for each additional user. This concludes the section of your implementation training defining each database in Sportswear Online and instructing you how to grant different types of access. As always, if you have any questions, please feel free to contact us. If not, please continue on to Part 3 on how to customize your pick lists in Sportswear.